We want to make sure that we have a clear decision strategy in what we're doing, that we're not doing flybys. A couple months ago, I wrote a newsletter on flybys, and I see this happen so often. We make a decision on the fly, and we're going, okay, that's it. This is how we're going to do things from now on. We want to make sure that we have a very clear decision-making process. And on that process, the number one question we ask ourselves is, what's in it for the patients, the practice, and the team? And there has to be something in it for all three: patients, practice, and team. Does it support the vision and goals of the practice? Is it supporting that? Is it welcoming? Does it make our patients feel comfortable and welcome and enhance the relationship? And is there something in it for the team to continue to do it? The why behind it. And also then, is it practical? You're going to hear things over the next couple days that you're going to take back to your practice, and you're going to go, this is it, this is great, we should do this, this is amazing. Let's be practical. I'm a very practical person. I don't want to burn out even the most engaged team members, because if it's not practical, if it's not realistic, we can't do it. When I think of service, I think of it as a triangle: time, money, and people. So let's say, who answers the phone in the front office? Who? Okay, what is your name? Caitlin? Thank you, Caitlin. So Caitlin, are you by yourself at the front? Okay, there's three. Good for you. Is there anybody here in the front office by themselves? Anybody here by themselves? Okay, she's like, okay, I'll raise my hand. Okay, what's your name, sweetheart? Christina? Okay. So Christina, you are just the perfect person to be at the front. You're smiling, you're beautiful, you're happy, you're energetic. But what do? The phone's ringing, people are checking in, people are checking out. Do you feel like an octopus sometimes? And then I'm saying entice people to come in, and you're thinking, are you nuts? I just got to get off this phone so I can get people taken care of. See, let's be realistic. No judgment here. This is reality. Thank you for participating. This is reality. If we want to deliver service, if we want this exceptional service, we have to set our people up to succeed. If she has to be all things to all people, and then she's probably got other people standing by going, Christina, what about this? And she's like, ah, right? Do you feel that way sometimes? She's like, yes. Okay, doctor's sitting right next to you, right? Doctor, just turn away. But this is the reality of things. We have to be practical. So she can't spend the time on the phone that she would want to, or she can't spend the time with the person checking out that she'd want to. So the level of service is limited based on what she has time for, because there's no coverage, no backup. Does that make sense? Or hygienists. How many of you are hygienists in here? Raise your hands. Hygienists. I suggest an hour. We're going to get into that a little bit. Is your hour, who raised their hand? Raise your hand again. Somebody chat with me. Okay, up front, what's your name? She's like, oh no. They can't see you anyway, it's all good. What's your name?
Tara.
Tara. Tara, how long have you been a hygienist?
23 years.
23 years, just a couple, yeah. Do you have an hour appointment? Yes. Is your hour full?
Yes.
Yes. In fact, you probably only go to the bathroom every second or third patient, yes? If that. As fast as you can, yes, I know. There's no downtime. There's no magazine time, I get it. Okay, so here's the thing, Tara. If you already are full, 60 minutes, and you have all these things you have to do, let's be realistic. If you hear something over the next couple days and you go, I want to start implementing that in our process, and you bring that back to the practice, something you already are doing has to go, or you have to lengthen the time. Because if we can only do it occasionally, it's not a standard. If we can't do it consistently, the number one thing with service is managing expectations. And consistency is the key to that. Because if we deliver service one way once, and especially hygiene appointments because they're the most compared, because that's what happens the most often. If we do something once, and then the next time they come back and they don't get it, it's a negative experience. So when we make this decision, is it practical? Do we have enough time and people? And if we don't, that costs money. So when doctors ask me, Judy, can you raise the level of service in our practice? I said, absolutely. But it's going to cost you. That's reality. So we want to make sure it's practical. And precedent, what's the precedent we're setting? Once we do something, it becomes expected. Be mindful, consistency, always ask anytime you're going to implement something, can we consistently do this? And then finally, are we passionate enough about it? Don't implement things that are nice to have. Oh, that would be nice to do. Implement things that are must have. And on a scale of 1 to 10, 8 or above, passionate. We want to avoid those unnecessary rules, those things that are the flybys that we make without having that process. So when we go through that process, what's in the best interest of the patients, the practice, and the team? What's practical with time, money, and people? What's the precedent we're setting? And are we passionate? That's how we're going to deliver exceptional service.